welcome to my channel. My name is Oriana. I'm a pelvic health physical therapist assistant, and today we're going to talk about pain with, I don't want to use the word because I don't want to get censored, but you know what I'm talking about. There are a lot of people who have this. It is an extremely common thing that we treat in the clinic, and so I'm going to give you different strategies that you can try before you have an intimate night with your partner. Now, first things first, I think it's important to understand why pain with happens, and it can happen for different reasons. Maybe you had a baby and you have scar tissue in the area, and that scar tissue is extremely sensitive. Maybe you just have a lot of pelvic floor tension just for so many different factors. Maybe you had a traumatic experience and your body is just muscle guarding like crazy. If you ever have an injury in your body, you will notice that your body protects itself. It literally muscle guards whenever you try to get anything near that tissue. It's a natural reflex that we do to protect ourselves. And so what we want to do is lengthen the pelvic floor muscles. We want to tell the nervous system that it's okay. And if those two things don't work, then we want to go see a therapist. So that way they can help things out a little bit more. I have my pelvic floor right here just to show you that we have all these different muscles. We have the external muscles, and then we have the internal muscles that are going to be on that inside. And whenever you have something going inside, these muscles have to be like soft enough to let something go through. So you don't want them to be too tense, right? And then also on top of that, if you're trying to have an O, again, I don't want to get censored, then these muscles contract like crazy. So one of the analogies that I actually gave in the clinic today is like if your pelvic floor muscles are really tight for whatever reason, whether it is, a trauma response or it is just tense because things get really tight whenever mechanically things are not doing what they should be doing, then think about like the bicep. If that bicep muscle is really, really tight and then you're trying to have a contraction, then it's going to be hard for that muscle to go anywhere, right? And an O is a bunch of contractions, a bunch of really strong contractions, especially if you want that O to feel really pleasurable, right? It's going to be a lot of very big, strong contractions. But if that muscle is tight, it has nowhere else to go. So either you're going to have a hard time having that O, or it'll be painful after everything has finished. That is why we want to work on lengthening that muscle. That way you can actually get a better contraction whenever you're trying to get things going. Sorry, my lighting keeps changing, but we're going to go with it, okay? So one of the things that you can do, like if you know that you're going to have intimacy later on in the night because for whatever reason, you just know that's what it's going to be, then you could do things like singing, laughing, breathing, things that are like relaxing to your nervous system, just anything to show your nervous system that like, hey, it's okay. And the fun thing is that whenever you laugh, if you do those like big belly laughs, it's a genuine laugh. It's like, it actually puts pressure down, and that pressure can actually help to lengthen, like functionally lengthen the pelvic floor muscles. Same thing with like singing. Now if you sing like really high pitch, like super crazy, then that actually does tense up the pelvic floor muscles because the vocal cords are connected to the pelvic floor. But if you do a little bit more like lower tone, bassy type of sounds, or as long as you just have what we call the open glottis, so it doesn't feel like you're closing everything up and having to use your core to get that sound out, you're just doing a nice low tone sound, like humming or singing just like bassy type music, then that can also help out. And then the breathing strategies, so you can use the breathing strategies before that intimate time and during that intimate time too. I will cue you through a breath here together. So you'll take a deep breath in through your nose, and then open mouth exhale. Okay, I love doing that because it just kind of cleanses things out. Now let's take a deep breath in through the nose. And exhale like you're trying to blow out a candle softly. So the quieter you make the inhales, which I don't usually do whenever I do videos because I'm so worked up, but the quieter that you make the inhales, the more you end up using your diaphragm. And that diaphragm, which sits underneath your rib cage, when that expands, it literally pushes pressure down on the pelvic floor, and it tells the pelvic floor, hey, it's time to lengthen and open up a little bit. So doing those low tone sounds, laughing, genuinely laughing at something, or doing nice deep quiet breaths in and out, like out in through the nose, out through the mouth. Those are all super good at just preparing your nervous system and your pelvic floor for intimacy. Now, if you know that it's about to happen, maybe like a few minutes before, maybe whenever you get over to your partner's house or your partner's about to come over, if you just know that it's going to happen, you can go step away in the bathroom, whatever the case may be, and do happy baby pose. So happy baby pose, if you're not familiar with it, it's where you go onto your back You pull your knees out to the side. You can grab onto your feet, grab onto your ankles. I like to grab just onto the back of the legs, and then you can rock side to side. And you would just do this for just a minute or so. The other option too, which I really like to do, especially if you are having a hard time having a good O, is to have your knees pulled in towards your chest, giving yourself a little hug and just taking deep breaths. And as you breathe, imagine that air is going in through your nose, through the back of your lungs, all the way down, out through your tailbone, basically. So inhale, exhale. And seeing if you could just feel like your pelvic floor and the base of your vagina open up a little bit. Those are so good to help lengthen out that pelvic floor tissue. Another thing that you can do if you're like at home or if you're with a partner who does have a foam roller, you can grab a foam roller between your legs. And then what you're gonna do, I'll go at an angle right here, is you'll just kind of like lift your hip up and then lower your hip down. Lift the hip up and lower the hip down, and that just helps to gently massage. And you don't need to do this that long. You can literally do it for like 10 seconds and be done. Make sure to do the other side whenever you do it. If you do not have access to a foam roller, you know, especially if you'd like the intimacy is going to be very random, then you can massage out your legs. So you could just like put a little bit of pressure here on the inner thighs. Those inner thighs connect to the front of the pelvic floor. And so if these inner thighs are really tight, it's going to make the beginning part, that entry part, not as comfortable. So you definitely want to massage that tissue out. And then the last thing that you can do, especially if like your partner is about to go into the bathroom or something, or you know that they're about to come into the room, you can lay down for a moment and you can massage your lower belly. Or, you know, you can also do this whenever you do the happy baby pose and everything. But you would literally just massage your lower belly. So you can do what are called the little abdominal scoops, where you scoop your fingers in and pull up. It's kind of hard to see, but I basically scoop in and pull up. And you can do that on each side, right? Or you can just do little gentle massages all along the lower belly area. If you have a lot of tension, it can actually feel uncomfortable to do this. But just know that the tissue that you have right here, that is, you know, your small intestines, your colon's more on the outside. And yes, you do have your uterus and your ovaries, but you're not going to damage them by doing gentle massages. So if you're doing a little gentle massage, that should be okay. And usually the more that you do it, the less painful it becomes. And that pulls at your pelvic floor tissue, helping to relax it. Now, what if it's painful whenever your partner inserts something inside of you? You can pause. So you can do things incrementally, where you have your partner begin to go inside and you take a deep breath as they're going in, because that deep breath is helping to expand that pelvic floor. So you would inhale as they go in and then slowly exhale, and then they can go in a little bit more as you inhale, slowly exhale until they are fully inserted. And if they just like wait a minute or two, usually with arousal, the pelvic floor tissue does a really good job of expanding and just letting things go in and out from there. So hopefully that helps. If you are still struggling with this, even after trying exercises like this, that's definitely when you want to go see a pelvic floor physical therapist. What they do, what I do, is you go inside. So they would go into the vaginal canal right there, and then we work on the muscles literally with our fingers. Whenever you work on the muscles, we just go in and we kind of like hook on and we just help to release the muscle, and that's it. So it literally looks like that. And this is like what I do for a living. We just kind of go onto these muscles, and it really is insanely helpful. We have patients who can barely tolerate like anything, and then they're able to tolerate a full thing. So if you're really struggling, know that there are pelvic floor therapists out there. And if your insurance covers PT, your insurance will cover pelvic floor PT. So if you're struggling to find a pelvic floor therapist, ask your primary care doctor, ask your OBGYN, and if they say, oh, well, you don't need it, and you have pain with, then you definitely qualify for pelvic floor PT, and you can find one in your area and then ask for them to write a referral to that place or use direct access depending on what state you live in. So I hope all that was helpful. Go ahead and like, subscribe, comment, give me little notifications, because this is brand new to me, filming all these YouTube videos, and I hope that, you know, you're able to use this and have better sex in the future.